The EMG nerve conduction test stands for electromyography and nerve conduction studies. The goal of this test is to try and map out the nervous system and see if there's specific pathologies or lesions that we can kind of diagnostically guide ourselves overall. The biggest things to remember as a patient coming into our clinic is it's not as bad as it sounds. Do not come in with any kind of lotions, creams on your body the day of the procedure, because that does interfere with the conductions and the test that we're performing. We ask you to wear loose clothing if we're working on your legs, shorts that can come above the knees, and if we're working on your arms, a shirt that can kind of go above the elbow so we can guide our study overall a little better. We of course have shorts and gowns if needed for patients to change into. It's done pretty simply. There's two parts to it. So the nerve conduction portion of it, we take these tiny little stickers, they're EKG style stickers, and we put them on different parts of your feet, your hand, and we use a little probe-like device to zap the nerves. Again, it sounds worse than it is, but we're sending a very tiny amount of signal to the nerve. In terms of what that feels for you, I explain to patients a lot of times it's like a static electricity, like a TENS unit in ways. You may feel little twitches intermittently as we activate some of the motor nerves. We're gonna give you a heads up as we're doing these things, and there's no rush in this test. We can take our time and ease you into it as tolerated if you're anxious or nervous about it. Most patients do really, really well. For the second part of the test, the EMG or electromyography, we take a very, very, very small, almost an acupuncture style needle, and we put it in different muscles to see what the signal between the muscle and the nerve junction is like. We are not zapping you anymore at this point. We're just putting a pin in there to see what's the signal between the muscle and the nerve junction. Initially, when we put the needle in, we're not having you do anything at all. You're just sitting there hanging out. Once the needle is where we need it to be and we're evaluating some of the signal at rest, we're gonna actually go ahead and activate that muscle. So for example, for your shoulder, I may ask you, go ahead and move your arm out like this slowly, and you may feel me resist you afterwards as well. It's not too uncomfortable. Some muscles might be a little more achy than others, but again, we take our time and ease you into the process. Overall, patients do really good before and after, and this definitely helps guide us more diagnostically in terms of where the lesion might be, if there's any compression anywhere, neuropathy, other neurological issues that can be very beneficial in figuring out where and what's going on overall.